So hungover.
Very. Welcome. You're listening to Nuditea, a podcast where we get naked with our feelings while drinking tea. I'm Kimberly.
And I'm Wendy. And on this podcast, we talk about food, travel, sex, adult things. Sometimes we have special guests, like today. We have Lauren with us again today for a different topic of discussion. Lauren, did you want to give us a little intro on what we're talking about and why?
Sure. Well, thanks for having me back, girls, and so soon. It makes me feel very affirmed and loved. I'm here today to change gears a little bit from last time, kind of focusing on sexual health.
Woo!
Woohoo! Yes, exactly.
Shall we start with our teas?
Yes.
As we always
forget, because I was about to forget. Lauren and I are both drinking a lemon ginger tea.
All of us are drinking the same thing.
Oh, wow, really? We're all drinking.
That was a waste of tea bags.
We all have relatively upset stomachs today, so we wanted some ginger in us.
Basically, it's just gonna be a very low energy episode today.
Seriously.
Okay, so topic for today. Lauren, I think it would be nice to start with why this is an important topic for you.
Mm-hmm.
Is it related to your job, perhaps?
Maybe.
What is your job, Lauren?
My profession is in sexual reproductive health, specifically in the area of midwifery. So I'm a registered midwife in Ontario. In the when I was working overseas, I got much more interested in sexually transmitted diseases and sexually transmitted infections and what their impact is on women's bodies. I think I've lately been really keen on talking about that, and Kim was like, come talk about it on the podcast. That's what I'm doing here. Kind of just to open discussion forum about what you guys know, what you guys think about it, what do you think are common misconceptions, and a little bit about self-diagnosis to get you into the doctor, essentially, is how to get you to the right spot, get you the right things. Well, I actually would just like to ask you guys one thing. If I say sexually transmitted infections, what comes to mind? Feelings, thoughts, impression, and it can be whatever.
You know what comes to mind? My Catholic high school upbringing, where in our sex ed class, aka one class from our religion class, we all got together in groups and we did a project on STDs. Back then it was STDs. Mm-hmm. And the rules of the game were, the scarier the photos you put onto your poster, the better grade you got. Because that sends a message that you got the point. Just don't have sex. Because then you will catch an STD and then you will have gnarly genitals for life and then you will die. Mm-hmm. So that's the first thing that came to mind. And I think that's very common misconception that STIs and STDs are something that's super, super scary and rare, and when it happens, it's kind of that's the end of your life. Mm-hmm. You won't be able to have sexual partners or sexual experiences. Your downstairs area is ruined, and what I would like to communicate is that some STIs and STDs are curable. Not all of them are very rare. HPV is just everywhere.
Oh, we all got it.
Most of us got it.
Yeah, not all. I don't want to actually say that.
As a young person, I grew up thinking that if I caught an STD, that was the end of the world. But now as an adult and knowing a bit more about STDs and STIs, it's more kind of you have to be careful, you have to be knowledgeable. Using condoms is probably the best thing that you could do. And also, if you do catch something, go to a doctor. They will do their best to sort it out. We're very lucky that we have the healthcare system that we have. So privileged to just be able to... Most of our problems can be very easily remedied.
I kind of like you touching upon sexual health education and kind of the parts that we're lacking on. And this is why I'm excited about this topic.
Well, how did you feel about Japanese sexual education for STIs and Ds in general? Just because I remember, actually, I think I got a lot of good information from Japanese.
Yeah, I feel like
so
maybe
it's a week-long section. Yeah. You have 4 weeks of health
better
class.
Than I had.
Yeah. It was never really shown that it's very manageable, or it did feel very like this is the worst thing next to, unplanned
Pregnancy.
Yeah,
exactly. Sexually transmitted diseases or infections, it's true. It's historically with sexually transmitted diseases, but I think the language around that is very negative.
Disease sounds worse than infection.
Disease sounds long term, like what you're saying. Like it's forever, it's your whole life. And we kind of associate it with like HIV and AIDS, which is a sexually transmitted infection, but it's very different from a lot of types of STIs, right? So sexually transmitted infection is like the term that's more commonly used. And that can be broken down into various types, which I want to point out a little bit later, like bacterial versus viral. They have way different impacts on the body. They have different types of treatment and stigmas attached to it, right? So we have a bigger stigma attached to bacterial versus viral and things like that. A couple like misconceptions. This concept of I will know when I have a sexually transmitted infection. Like everybody's kind of just, I don't need to educate myself at the moment because I'll know, something will pop up or
it'll be super obvious,
or like my partner will tell me or something like that. But I think we rely too much on ignorance and living in a world where we don't have those hard talks with partners and sexual partners and kind of just like open up that discussion. Because back to the whole bacterial viral, there's some things that you might not have symptoms for a long time that can stay dormant in your body. And so with your partner, you might not actually, they might not know and you might not know, and unless you're like having that hard discussion about testing before unprotected sex.
Is there certain STIs that are more commonly like stay dormant, or are they all just kind of like, there's a bunch, like gonorrhea could be dormant for a long time, chlamydia could be dormant?
Maybe dormant is not totally the correct word I should be using, because like
be a carrier
some people are they're clinically asymptomatic, but they're able to transmit it to other people.
So it's not so much dormant. So like as an example, chlamydia and gonorrhea, it's never dormant because it's bacterial, but it can stick around and you just don't have symptoms. So especially in men are usually asymptomatic for a lot of these types of things.
Those jerks.
And they're the ones that are like, you're giving it to me. No, I'm just joking. That's totally painting men poorly. They're usually kind of like the carriers and the transmitters sometimes, and women's usually are like the ones that kind of hold on to the bacteria longer. It's really sad, eh? Again, about stigma, a lot of the ones that are bacterial are easily treated, commonly transmitted, easily diagnosed, and actually with symptoms. If you're having symptoms, it's really easy to diagnose them because, and we can go through symptoms later, but the ones that are dormant, so like HSV, HPV not being necessarily dormant but constant in your life. HSV I think which is herpes, oral and genital herpes, is a really good one to talk about because the stigma is so high around it, and it's actually very common. And symptomatically, when people have such a variety of experiences, right? And as an example, having a cold sore, right? Like, I don't know, do either of you guys have cold sores?
No. Oh my goodness. I have a story related to this.
Do it.
So in undergrad, I was it was like one summer, and I had to go into the walk-in clinic at school because I kept having these like weird, itchy, red, hivey bumps around my lips. And I was like, did I catch herpes somewhere? Like what is going on? I feel like it might be an allergic reaction because it kept happening, and every time it happened it got a little, something's not right. So I went in to see the doctor, and the doctor was like super, super convinced that it was like some sort of viral infection, that it was something like herpes. And turns out it wasn't herpes. It was because I'm allergic to mango skin. And this conversation just made me think about, I feel like doctors, when they encounter a young person who is sexually active and around the early 20s, mid-20s age.
Whether or not they're sexually active, they make the assumption.
Yeah,
right?
and sometimes some assumptions are made that this is a sexually transmitted infection. And on our end, most of the time when symptoms come up, sometimes we're just like, oh, it's probably just like something else. Usually on our end, we assume that it's not an STI. Whereas the doctor, I felt like in that instance with that doctor, it was like,
that was
the first assumption is that it's an STI.
Yeah.
He actually gave me antivirals that I never took.
Yeah.
Yeah.
And it's interesting because at what point after you saw those did you see the doctor? Like, it was quite a time. It came and went.
Yeah, so I would usually have it for about a week. It would last for about a week after, and then the hives would go away. And at that point, I didn't really have a lot of knowledge on STIs. Thank you, Catholic high school education again.
Yeah.
So I really wasn't sure what it was, and I was kind of linking it up to like my diet and what I was eating around the time. But I just couldn't figure it out. So it's like, okay, well, if it keeps happening and every time it flares up, it gets a little worse, I should probably talk to someone about it. Turns out that was the opposite of helpful.
And I like that story because I also had a similar story where I had pink eye and I went to get some drops, and the first thought, they thought I had chlamydia in my eye. And I was like, interesting. Like,
it's just good old pink eye.
Which, actually, chlamydia, this is, I think, good to kind of touch upon because what you were saying, you can have chlamydia in your throat from oral sex, you can have it in your face, you can have obviously in your genitals. Actually, at the time of delivery, if a woman is symptomatic for chlamydia, there is concerns about bacteria getting in the baby's eyes and causing some infection. So it's just sometimes you don't realize that it can happen there. Nobody tells you that. Nobody tells you it can be oral.
I think that's a little more well known now, though.
I would hope so.
Yeah. I think
the eye
generally
thing,
now,
though, I would never think it would be
like in your throat. Like if you had a sore throat and you didn't realize that somebody was symptomatic for chlamydia, it could technically be in your throat.
Yeah. So like when he was saying, we tend to be like, oh, it's just this, or it's just
that.
Wendy
like,
and I use each other as doctors.
Which
and
regularly
we diagnose each other.
Which is kind of reasonable. So
given our background, because we both went to school for life sciences, for human biology type programs, so when we bounce ideas off of each other, for us it makes some sense, and we know reputable places to look for information as well.
We do know when we actually need to go to the doctor.
But like we're also very clear in the line that's being drawn. Like I feel a certain way, and then I'll just joke around with Kim and ask for her diagnosis up to a certain point, and then I'm like, no, it's time for a real MD to come into the picture. So I feel like with us, we were just a little more able to grasp where that line is.
Yeah.
But even when we were younger, I feel like when you're just starting to become sexually active, that's not even something that you would discuss with your partner when you're just setting out, because like everyone at that point is basically a virgin or assumed to be a virgin, and when you're just becoming sexually active, that may not be a conversation you're comfortable with discussing with your partner.
And I think that would be reasonable. Like as a parent, if you had a teenager who's becoming sexually active, if you had an open discussion with them about what is the age of the other person and what do they believe their sexual history is, I think having testing right away doesn't actually make any sense, right?
Yeah.
But teaching them about symptoms, teaching them about protection, teaching them about understanding their partner's sexual history, those are more important than just being like, oh, gotta get them tested before you have unprotected sex, because that's not very reasonable, I think, for like a teenager having sex.
But I think that kind of, because when you start out in the mindset of not having these discussions, it, for me at least, it carried through for the rest of my adulthood when I was sexually active, because I think it was not until my third relationship that I was like, oh, no, we should both be testing and be open about what our test results are.
I think it's a really hard place to get to, actually, with a partner, to be like on the same page about testing. I think women, because I think men are informed about their genitalia, but I think as women, we're dealing with periods, we're dealing with like kind of a hidden genitalia, which we have PAPs for, and because we're encouraged to do something that's routine, like a PAP, that kind of brings up that like testing aspect. And so we have more opportunities to test than our male counterparts, and often men,
but they can visually see it better.
Totally, but that they aren't symptomatic. Yeah, for sure, they can see it. And I do think, like, talking about like sexual identity, homosexual men are more aware of
the risks involved.
Yeah, and testing. There's more, it seems, this is like kind of speculative, but like it seems that they are testing more often. And there's also specifically around HIV, like there's PEP and PrEP. So I don't know if you guys are hearing much about those. So like post, if you, let's say, are having and this should be for heterosexuals too, but we just don't have it in our community as much, which is crazy. So PEP is after having unprotected sex and having a risk for getting HIV. You take it for the 30 days after, like let's say a condom broke, or somebody just disclosed they have HIV after having sex within it has to be within 72 hours of unprotected sex. There's some pills you can take that are really hard on your body, but they essentially reduce significantly the risk of you getting HIV. And then there's PrEP, which is newer, which again, the homosexual community is like kind of spearheading, is something that you take before like having an encounter with somebody that you don't know their status, and so you take it on a regular basis. I don't remember exactly what the time frame is before having sex, and it reduces the risk of having HIV. So like there's and heterosexuals, I think everybody should technically know about this. If you're having sex with multiple partners and you're not exactly sure what people's statuses are, like these are things that we're again not taught about and we're not necessarily encouraged to use, but would be huge for reducing transmission. I do want to kind of go over like the splitting them into two groups, because there's two different stigmas about it. So there's bacterial STIs, which people have heard about, like chlamydia and gonorrhea. Trichomonas is one maybe most people don't know, but it's another one that's out there. It's a little bit harder to diagnose because of the ways that we take those samples. The actual bacteria kind of dies and we don't see it, so it's more of a symptomatic approach, and it's easy enough to like treat, so very easy. And then the ones that are not sexually transmitted but can look like a sexually transmitted infection are yeast infections and bacterial vaginosis. So those two are not. Kimberly can tell you stories about bacterial vaginosis.
And I have had one UTI,
yes,
so I can talk about that.
And you're and so that's the thing.
Like you're peeing a knife,
basically.
UTIs are tough and often aggravated by sex, for sure. And so like they all kind of are together, and the symptoms can sometimes get a little bit blurry. So when it comes to bacterial, like the things you're looking out for are irritation, pain with intercourse, discharge, foul odor,
any color change or anything like that.
In the discharge, yeah. So like as an example, trichomonas is more of like a yellowy green discharge. Chlamydia and gonorrhea is still pretty whitish, but it's just foul smelling. But you might not have discharge when you have these things, and that's the thing, right? So irritation, pain with intercourse, specifically because it causes a lot of pain around the cervix, so that when there's penetration it hurts, that kind of thing. So if people are noticing that, those are bacterial, and those are very easy to treat, and they're very common to spread. It's not a sign of promiscuity, it's not a sign of
unhygienic.
Exactly, that's a great way to say it, unhygienic. If you are diagnosed, though, public health knows. So that's the thing in Canada, what happens, right? Like, if you're formally diagnosed through a public health system, that gets put into a database, and that's just to help track. It's not about, again, shaming. It's about tracking infectious diseases, which is really important in Canada. But it can be hard for people because then that status is there, not being shared with the public, but like it is there used for data collection and like
for researchers
and stuff like that.
Yeah, for people like this that research like viruses and things like
one
that.
One of my lab mates actually is doing her whole project around chlamydia cases in Ontario. So this is like so
she should be here. I'd love to hear about her.
Honestly, this is from a public health perspective, it's very important for people who think they might have an STI or definitely do have an STI, and when they go in to see their doctor, that they allow their information to be recorded, because it's totally anonymous. It's not like we're going to come knocking on your door and be like, hey, we know you had an STI. Come with us. We have some things to chat to. No, it's not like that. We gather these cases and we can see where these outbreaks are happening in populations, and that can kind of tell us a little bit about the demographic, maybe something's going on there. So it's important not only for yourself to go in and get treated, but also for people working in public health to know about, you know, high risk areas or populations, and being able to think about things that we can do to help those populations maybe not become infected so often or not as much, or reduce risky behaviors.
No, that's great. I really like that though, like hearing that somebody's doing that type of research, especially because we're actually having a high resistance rate for the treatment of chlamydia and gonorrhea. So we're getting like super bugs.
Oh boy.
Which are sometimes, and this is big in the UK recently. So like, it's important for people to get tested. It's important for people to get treated. It's important for people to finish treatment and get retested. So that's a big thing about chlamydia is you get tested, do the treatment, and then have to show a test for cure. It's important. And what was the other thing? I also want to explain, there's a couple ways you can get tested. Like sometimes people are like, well, I'm really scared to go to the doctor, and then they're like touching my stuff and whatever. So a few different ways to get tested for all of these bacterial STIs. You can actually do through urine now. So chlamydia and gonorrhea can be tested just through a urine sample, which is one route. The most accurate route is swabs. So often a physician, you would go in, you discuss your symptoms, they would have you consent for a PAP, a speculum examination. And if you need a PAP at the time, they'll do a PAP. And a PAP is a collection of cells from your cervix to check for cancer, which is different. Sometimes people think if they get a PAP, that means they've done STI testing, but that's not always the case.
Do you have to tell them, I want it tested?
Yeah.
Okay.
Yeah.
You have to be very specific about that.
Well, often if you're going in there wanting screening, then that's what they're going to be doing it for. So they'll do a speculum examination, which involves putting a metal instrument. Sounds very scary, but it usually can be very fine and uncomfortable, but not painful. A speculum examination where they put a swab inside your by your cervix, and they take a little bit of a sample from there, and then they send it off to the lab. So that's the most accurate way to get these things. Also check for
I've
yeast.
never had that
everything.
done. I've only peed. I've only done the pee test. Yeah. And
And
that
then
was
times-
after I did the pap smear, because I was due for that. And then the doctor at the time told me, "Oh, while you're here, do you want to get this done?"
Yeah.
But I have a question for you guys. How do you guys feel about both the pap smear and the STI testing? The fact that if you don't have an infection, I don't want to say clean, because I think that there's some discussion about using
those terms. Yeah.
So if it turns out you test negative for everything that they tested for, which is another point, they don't test necessarily for everything, you don't get a response back. You just assume that you don't have an STI if they never, ever, ever get back to you on it, which I am not a huge fan of. In this day and age, how hard is it for you to shoot me an email to be like, hey, your test results came back, all negative, go out, be safe. And I find it pretty stressful because I still don't have pap smear results back. And I called them and I was like, hey, what is going on? They're like, oh, if you didn't hear anything, it's probably that you're fine, which I don't like. It stresses me out.
Because it's one of those things that maybe just miscommunication, like something happened and the information didn't get to you, even though they probably have fail-safes for like making sure that doesn't happen. But it's like an interview. You just want to know if you got the job or not. It's the same thing. Like I just want, like if it's a no, just easy, quick.
In the type of work I do, we're really fortunate because we're having constant follow-up with our clients or patients. So we do tell them the results, and that's the thing, right? Like either they call us and we get them it over the phone, or we see them at their next appointment. So you're completely right in that. So you can't get blood work done. Let's say you're going to get I want to check my blood type. You can see those online. So those are the ones you can see online. But anything public health, you cannot see online. You have to hear either the results from the practitioner or you don't hear them at all. And it's really annoying, actually, because I don't think
it's stressful. It
kind of is like out of sight, out of mind. And most likely they're not missing too much, but there's just no reassurance. You're like, how long are these tests supposed to take? Like, when is no news, good news appropriate? Like, if I don't hear from you in a week, does that mean I'm fine? Or do I have to wait 3 weeks before it's fine? I agree.
So I got like a swab done and all that. They called me, but I was at work, left a message. I tried to call them like multiple times, but either he wasn't in the office or nobody like could answer it. They never like tried to get back to me. I'm assuming it wasn't a big deal because they weren't like, oh, did she get the information, blah, blah, blah. And it was on my end, I guess, to keep trying to call them, which is frustrating because their office hours were like when I was working. So I was trying to do it on my break, but that like, it never panned out. And it's just like frustrating. I'm like, do you just assume it just took care of itself if you're not like following up to make sure I actually did get the information? And what communication was dropped somewhere. And I could have been more diligent, but also...
Do you want to talk about your experience getting that swab? Or was there anything to talk about? Maybe there's not
really. I think it's just normal.
Yeah.
Probably.
I really don't I don't like pap smears. This is not related to STIs, but I'm not a huge fan of pap smears. The first one I had was very traumatic because it was cold, and then whatever she stuck up there it felt punky. I didn't like it, and it kind of hurt, and I felt weird. Like for the rest of the day, I felt like my vagina was just like producing excess discharge to like try and lubricate. The second time I had it was much less traumatic. It was still cold, but I didn't feel the actual like sample getting taken as much, so I didn't feel as squeamish for the rest of the day. I feel like I'm just not a huge fan of getting that done. And the pap smear is like once every 5 years?
Yeah.
3 years?
It used to be every year.
Oh yeah. Didn't do that.
But no, it's nice that it's every 3 years. It's true. So it sucks because then women they're super unthrilled that they have that coming up, right?
And I'm interested to know, because when we go into the doctor for like a pap smear or anything, often the practitioner will ask us, oh, are you sexually active? You know, all these background questions, which sometimes can lead to asking you if you want to get further testing done for STIs, which I think is just very natural. But when men go in for just general checkups, I guess, they never have to go in for a pap smear or anything. How does that conversation come up, and if so, how often? Because how often do men get asked, oh, are you sexually active, if there are no other symptoms that can inform the doctor as to something's going on? I don't know. I feel like women kind of are often hit with the brunt of the STI panic and
the pregnancy panic
and just all the panic,
and a lot of the stigma around like promiscuity, right? Like, so because we're being tested more often, we're often the ones that are being like stigmatized because if we test positive for something, we're treated, and then we're told that our partners need to treat. And so then it's almost like, oh, you're being treated because of what I'm doing, right? So I'd be interested to hear from a man. I don't have that much experience with male healthcare, but I know when I was at public health to get some checkups and stuff like that, there were the other patients there that were for the drop-in clinic were only men. So it's interesting because this is what I'm saying, is I think that's actually potentially part of the LGBT community, is like they just have a bit more
awareness.
Again,
because the risk is higher, and historically STIs within the LGBTQ community has been like a huge topic for public health and for people in that community, which is bad because there's a lot of stigma surrounding it, but also good because people are just more aware of what to do and things to look for and knowing about the risks involved. I feel like the het community is just really slacking in terms of sexual health.
Exactly.
And we're just as affected.
No, for sure. And I would say like anal sex or like oral sex is not specific to LGBT communities, and so like really risk is maybe slightly increased in their community, but it's not enough to make them the ones, like, the poster child for it. You know what I mean?
Exactly.
So,
everyone is a poster child for STIs.
Exactly.
Because, you know what? Because we all have HPV.
Exactly. We all
At
do.
At least, like, a certain percentage.
Bring back that misconception.
So, like, HPV, and HPV is an interesting topic because it's the only sexually transmitted viral infection that we have a vaccine for, right? So
who has Gardasil vaccine?
I do not.
No.
Good job, Wendy! I
do.
No. Yeah. No, that's awesome, right? And that actually, too, like genital warts, people don't maybe know that genital warts are HPV, and the vaccine can stop that potentially, like that viral strain. It depends on the strain from having genital warts. So if that's like something that's important to people, not to like develop genital warts, then that might be.
It was kind of weird timing for me to get the Gardasil vaccine because I'm in a fully committed monogamous relationship that is like we're assuming that's going to be lifelong. So I literally finished my course of Gardasil in December.
Nice, but okay, tell me more about the Gardasil thing.
One thing I will say, Wendy complained about the price of it.
Oh my goodness!
Did you pay out of pocket?
I paid it. You have to pay out of pocket. It's not covered by insurance
unless you're under 25.
Unless you're
because OHIP plus, right? OHIP plus.
I'm pretty sure OHIP plus doesn't
do.
I'm pretty sure, because when I asked about Gardasil the first time, I was under 25. And at that point, they said I would have to pay out of pocket.
See, that's just...
See, I think it's 170.
But if you're like 13 or something,
shot.
like
I think
somebody's covered
somebody's covered. I think it might be the group that's just
I should know this
real
and I do
young. I don't know.
You know, the ones that haven't had sex yet. You know, like the ones that are assuming
just
haven't had
targeting
sex.
the ones who are really not infected yet.
Yeah.
So it's a course of 3 vaccines. You have the initial, and then you have 2 boostery vaccines, and it takes a total of 6 months, I think, to complete the course. You take the first one and then wait 2 months. Oh no, 3 months or something. I don't know. You just have to wait some time in between. The shot itself is fine. It's just a normal vaccine.
Did you have any kind of side effects to it?
I did not. I will say, though, that second vaccine hurt more than your average vaccine. My arm was sore for quite a few days after. Usually after like a flu vaccine, you might be sore for a day or 2. This one I was sore for like a good 3-4 days. It was very sensitive to touch. But I mean, like, it's
Do you think
whatever.
that's just how the needle was administered?
I think I asked the nurse about it, and I forgot her answer. But there was something about that vaccine that made it a little, more painful for your body.
The second one in particular.
I think it was the second one. I'm pretty sure it was the second one. And then the third time I went, for that last round of booster, I was like, that last one was a doozy. And she was like, oh yeah, that one had whatever she said was in there. That's why. But then she was like, this third one shouldn't be as bad.
Oh, good.
Yeah, so it was just the second one that I remember vividly because it was annoying.
Ouchie.
It was annoying because it's been shown to work and it's been shown to be effective. Why is it so expensive and and it's
such a deterrent, actually.
inaccessible to the majority of the population who can't just drop almost $200 3 times. So even for me, it was a little bit painful, not just physically, but emotionally.
And you just think from a cost risk analysis, like it's preventing cancer. What is that impact on our healthcare system?
I think it's just important for us to really catch kids when they're early and just tell them to be safe about it. And
teach them how to have that conversation with whoever they're being sexually active with.
I also think it's not the end of the world if people don't use condoms. It's just about knowing your statuses for everything before not using condoms.
And the type of relationship that you're in.
Condoms are the only type of birth control that can protect you from sexually transmitted infections. You always need to underline that. So they're worth it.
The pill doesn't work, guys.
No, it doesn't keep it away.
Doesn't cover anything.
And any touch. So, like, even if it's, like, female with a female, like, you can still pass many STIs, things like HSV. And if you're, like, having mucus on mucous membrane, you're going to have more risk of getting gonorrhea and things like that.
I have read that if it's female and female, the risk is a lot lower compared to male and male or male and female.
Yeah.
However, I was listening to a podcast, The Heart, and they were talking about this woman went to go get tested for like an STI. I can't remember which one specifically. And she was a lesbian and she was in like a monogamous relationship, but she's like, I want to get tested for this. And the doctor was all like, there's no point. There's no way you would like anything in a female to female relationship. And she was like, no, I need tested. She had an STI.
I think that's the hard... So when people make assumptions, people might not feel comfortable disclosing their sexual history to their practitioner. And so that's the great thing about STI screening. Like, it's not judgmental. You do it for anybody. Doesn't matter their sexual orientation. Doesn't matter their gender identity. You just do it, right? Like, it's cost effective, and we don't want to make the assumption just based on somebody's situation right now that there isn't something in the past. Like, a lot of people have had sex with both genders.
My experience is I've always been pushed into it aggressively by my doctors, and none of them have ever been like, oh no, you're fine, you don't need this. I feel like all of them have been like, aren't you getting this done? Why aren't you getting this done?
Your doctor female?
The one from undergrad was male, and then the 2 that I've had since being in grad school have been female.
And would you say all three were similar in their...
The one in undergrad was the one who just thought I had an STI when I didn't. So
Right.
all three of them were pretty...
That's good. I'm glad to hear
I think
that,
it's
though.
like based on assumptions. The three that I had were just very concerned about me and my safety.
On campus, like,
Yeah.
practitioners probably like, yeah, STI.
Yeah.
It's rampant.
It's all
Get
over the place.
tested.
Exactly. On herpes, because that one has a lot of like impact on people's social and mental health because of what it kind of encompasses and means. So like we already talked about, like you can have cold sores and you can have genital herpes, and it's not that different from chickenpox and shingles. Same more or less strain, same kind of how it appears in the body. You have an initial infection, and then after that it lays dormant in your ganglia. I can't even remember the actual like biology behind it, but it stays dormant until something either triggers it because you become immunosuppressed or another compromised situation in your body, and it just kind of pops up. It's really hard to actually diagnose. So when we were talking with bacterial infections, those are easier to diagnose because you can get a swab, you can find the bacteria. HSV, it's a toughie because often the first initial infection, you have a very painful vesicle, which is like a little bubble vesicle. Yeah, very painful. So people notice it right away. But the medication that's used to help treat the symptoms has to be started within a couple days after seeing it. So often people are not able to get to their doctor to get that treatment. And then for diagnosis, they have to be able to get some of the virus on a swab and send it to a lab, which if it's already started to heal is very hard to do. So it's not the most accurate way to test. So they often diagnose based on symptoms. So if you have vesicles that are painful and they are able to be visualized, they'll try to take a little sample of it. But if they can't actually get a good sample, they will give you still the antivirals, the retrovirals. And then after that, usually that first lesion goes away. And then after that, with good understanding of how to keep yourself well and the use of retrovirals, most people can keep the symptoms down quite a bit. And the most important part about it is just not having sex during an outbreak or when you're shedding. But that's hard because some people don't know that that's happening when they're having sex. So another thing is condoms. If the vesicles are in a place that the condom's not covering, it is transmittable. So there's a lot of like stigma around like you're unlovable, you're dirty, you now got this virus forever, and it's the mental health side of it is the hardest, right? You're dealing with something that you have to disclose or not disclose, and you're struggling with that, right? Like with just a one night encounter, do you disclose that you have herpes, or do you just make sure you're not outbreaking, make sure you're on medication? Or with long-term partners, like I've had clients who have disclosed to me and not disclosed to their partners, and that's like it's very hard for them to kind of know how to navigate that because there is risks in pregnancy with being having HSV, and I find that one for sure, even almost more than I would like HIV is for sure lifelong too, but that one, when you're taking the retrovirals, you can keep the levels of the HIV in your system at such a low level that it's almost like you don't have HIV.
It's like 99% or something.
Yeah, they saw that they did a study where they found that people who were considered HIV positive, so had high viral loads in the past, once they were on the medication, whether they were having protected sex or unprotected sex with a monogamous partner, the risk of transmission was the same, which is really exciting. Like that we're at that time in our lives. Like just think about in the 80s, which wasn't that long ago, 30 some years ago, where they were at, and now we're able to keep in such low levels. So I think HIV still has stigma, but it's an easier stigma to... I'm making this judgment call because I don't have HIV and I don't actually understand what's going through people's minds. But I think treatment-wise, if people are able to consistently follow up with their treatment and get good healthcare in Canada, their lives are not as visually impacted. Like they're not having to deal with the same worry about outbreaks and things like that somebody has HSV. So yeah, those are the two kind of harder ones that when people get those diagnoses, there's a lot more to deal with that can't be just like fixed with a one course treatment essentially. Yeah.
All this talk about having to deal with these infections after the fact just makes me feel like it really should be emphasized early on how important protection and these preventative measures are, because like no one wants to deal with that. Even with something like HIV, where we have these treatments that are so effective that it's almost as if you don't have the infection. It's still like you still are having to take retrovirals forever.
Forever.
So
Exactly.
I just wish our sex ed programs were much more effective at emphasizing how important protection and preventative measures are. And I think they're getting a lot better, hopefully, right? I don't know. I don't have kids in school. I don't know how they do things anymore.
I honestly want to talk to one of my old health teachers and just see how they've updated the curriculum and also how they feel about the new
Government.
towards the government cutting back on what they can and cannot teach.
Yeah.
And I want to see if it is just very much the same as what I got, or they've had to obviously include things like homosexuality and just different things that they would never have touched upon.
Because you know how controversial that is, right? Like, parents are, like, boycotting things. Yeah, it's really tough. But the contraception talk is huge on my mind. Like, I just think we should, like, celebrate relationships. We should celebrate healthy relationships. And one way to do that is prevention of STIs and pregnancy. Yeah, and with all that's happening down in Georgia right now with their new laws and all that stuff around abortion, it only underlines more how important preventative medicine is, because we can't rely on our government to protect our autonomy and our right to our bodies. So we need to educate people about how to keep themselves safe, because it seems like that's in our hands and we can't rely on them all the time. I don't know why I want to say this is like a PSA.
It is kind of a PSA though. And I feel like it's a subject that we're fairly passionate about. As ladies, is that different for us than for guys? Because we can have conversations about this stuff all we like. Do males have conversations about STIs with their friends? I'm going to probably say not that often.
I would love to hear if they do.
Let me call one up.
Ben, where you at?
Okay, here we go.
Okay, so we're talking to Ben after this podcast recording because we wanted to ask you. I had 2 questions that I want to ask you. So the first is, as a straight male in a committed relationship and in your previous history with doctors, has it ever come up where a doctor has told you that you should get tested for STIs?
At like a regular visit without you prompting.
I don't believe so. I don't think I've gone to see the family doctor for a number of years now, but I've never even going in for a checkup. I don't think it's been mentioned or anything like that.
Okay. And then my second question was, within your group of male friends, does it ever come up, the topic of STIs and random symptoms where maybe you're suspicious there's something going on, or maybe you're kind of just like laughing it off with friends like, oh, I thought I had this, but I don't because it went away. Does that ever come up within your group of friends, your male friends?
Not that I've ever had that conversation with any of my friends.
See, this is what we thought would be the case, because we were saying how we felt like a lot of the brunt of the stress and some of the anxiety to do with STIs is focused in the female population, because sometimes it's just a lot more apparent to us in terms of symptoms.
Because women have, a pee hole that's different. It's not gonna have that burning sensation.
Oh, Ben, you don't even know. The pee burn is so real.
Yeah.
Well, this is true. I don't know what it could be, but I've always heard, does it burn when you pee? And there's only ever something wrong. That's when I imagine you would go see, but...
Right. I guess...
Also, a lot of my male friends aren't really, sexually promiscuous in any sense, so...
But is that like an assumption that if you're not... if you've had more than one partner, are your friends getting tested? I guess you're not having that conversation. That's the question.
Would you feel comfortable having that conversation with them?
Sure. I feel like if I'm thinking to my current friends or the close friends that are male that I would have that conversation with, don't think there's a lot of multiple partners happening. happening. There's a in unison. But I don't see why I would have a problem having that conversation with them.
Okay. And why do you think it's never come up before within friend groups that you've had or with your doctor?
I've had one sexual partner.
Yep.
Who has also only had one sexual partner.
Maybe we should just hang up on Ben now because he is not, he's probably not the person to go to talk about like testing and everything.
But I do think like the fact that does your family doctor know your history and do you think that has something to do with how they're not like asking you if you want to be tested? For men, there's not like this annual or every few years where you guys are being checked out, so there's not that opportunity. And I'm just thinking like, when does that happen for guys?
It seems to be on a like as per needed basis. Like if you think something's wrong, or you've got like some bumps or redness or rash or whatever symptoms you have, that's when it's like, well, maybe I'll do some light Googling, handle it myself kind of thing. There seems to be, I'd rather handle it myself than share this moment of weakness with anyone.
Right.
Okay.
Interesting.
Because if you are listening in like Ontario, your wide fan base,
we have one in Sweden because a friend from high school.
Oh, I love that.
I don't know if she's still listening.
So the public health clinic does drop-in sessions for screening if you're symptomatic. If you're not symptomatic, then they would book you an appointment. So just call your local public health and ask them about getting seen, and you can do that. So it's something like sometimes you just don't even know where the services are, right? Like you could go to your family doctor and that's totally fine. Sometimes it takes a long time to get in there. And if you're symptomatic, you should probably get it done quicker. So that's why those drop-in centers are really good. You might have to sit around for a while and you might have to take off time from work and things like that. But it's great. They can give you like a prescription to get the medication right away and they'll send off all your blood work and stuff and then they'll call you back. Yeah, and they deal with this all the time so that you're not having to like advocate as much for yourself because their job is to check because it's public health, right? Like they're thinking about it in the whole
grand
system.
scheme.
Yeah.
You said urine, testing, swabs, we talked blood.
No, we did not talk about blood. So yeah, they might have you do a blood test. So that's like how viral infections are often diagnosed, just through your blood because the virus will be in your blood, whereas bacteria can sometimes just be found in one specific region. So syphilis is diagnosed through blood. Hepatitis B, C are also diagnosed through your blood. So those are ones that are kind of commonly linked with HIV, and then HIV would be through your blood as well. So yeah, you might have to get some vaginal swabs or some urine samples or some blood tests. Women often, if it's a viral type of infection, you will feel flu-like symptoms. So it's not uncommon that like if you have syphilis or HSV, you'll probably just feel sick. You'll feel a little bit off. You don't have to be like really sick, but you'll just feel a little bit like under the weather.
Is there a reason why women tend to?
Because viruses cause like an inflammatory response in your body, right? So like any virus, which
but
like,
men don't feel...
Men as well. Sorry, men and women. Did I say women?
You said women in particular.
I think I'm just like looking at women.
You're just perpetuating all
terrible.
The misconceptions
I'm
that
so
you came out here
focused. I think the reason I care so much about women when it comes to STIs, like obviously men, it's very important for them to get tested, screened, and treated. But for women, like you can get pelvic inflammatory disease, like if you have untested. So like if chlamydia or gonorrhea are in your body chronically, it can cause your uterus to get very inflamed, and you can have lots of cramping, and that means you need more antibiotics, and that can hurt fertility.
Would you get like scar tissue from that and stuff like that?
Exactly. So like, yeah.
That's actually a really good thing to talk about. So because you're a midwife, what do you know about how STIs affect fertility? Because I'm planning on being pregnant in the next 5 years or so. I haven't heard back about my STI testing, so I'm assuming I'm okay. But, you know, in case something comes up, I want to be aware.
Yeah. Bacterial infections can cause inflammation in your uterus, which can put scar tissue or around your, like, fallopian tubes. So it's mainly causing a difficulty of the egg
ovulation
to like, actually get to the sperm in the fallopian tube.
So IVF would be a way to...
Well, I often like just like treatment, like really the scar tissue is like chronic. Like that's if you have chronic pelvic inflammatory disease. This means like months to years of this problem. So for the average person that's having like abdominal pain, they're going to get that sought out, they're going to get it treated. But for maybe some women that are marginalized or don't have access or are like not in a position to be able to see their doctor based on like a relationship or something like that, they're the ones that are more like concerning, or like substance abuse and stuff like that. So yes, you do want to make sure that you don't have an STI, because it will just overall make it more difficult for conception. But we have women that come into care pregnant well into their second trimester, and we find out they have an STI. So it's not so much that like if you have an STI at the time you're pregnant that it causes like a big problem. Okay. Again, with the viral infections, those are very different in the fact that if you do have herpes and you're pregnant, you will have to take a retroviral at the end of your pregnancy to reduce outbreak, because there is risk that if the baby gets the lesions on themselves, that there's a big problem. Obviously HIV, there is like special considerations for reducing transmission to the newborn. So these are not fertility, but just like impacts on pregnancy. But in regards to fertility, it's mainly what we're talking about with the inflammatory pelvic. Yeah.
And then once you are pregnant, having an STI is kind of like a different issue. It's if you're going to be transmitting this onto the baby.
And technically chronic, like an untreated STI does increase your risk of miscarriage. It does. Yeah. So like that was something that I saw quite frequently actually working overseas, where there wasn't good recognition, treatment, accessibility for women. And so I would have a lot of preterm labor, a lot of miscarriages that were most likely caused by sexually transmitted infections. So yeah. So it's good for us to know those things. But your body's pretty good. Like it holds on to your pregnancy. Like it's not quick to remove the pregnancy just based on the fact that you're having like a virus or something like that. Like
it wants
to stay pregnant, but it can increase your risk. And even bacterial vaginosis, which is not sexually transmitted, can increase your risk if you've had it a lot in the past, increase your risk of preterm labor. So that's also something you could be tested for in pregnancy. So these are all things that you would get tested quite early on in pregnancy that you would just make sure. Yeah.
Did not know that.
Yeah, but this is why I care so much. Like it's really important that men get checked, because they're in the relationship. They're the ones potentially transmitting or receiving and then transmitting again. Yeah. So they need to be checked. But for women, I just feel like this has such a big impact on like day-to-day life and just overall health.
That concludes this episode of Nudity. If you want to find us, we are on iTunes and PodBean and YouTube, all under Nudity Podcast. Yeah. If you want to email us, which I don't know if people even really want to, and I haven't checked it.
You know what? Just don't email us.
nuditypodcast@gmail.com.
It's terrible. We're not going to email you now.
Listen, to all 5 people who watch this, don't email us. We won't check if they're our Gmail account.
Just text them, because you know them.
It's true.
Mom, talking to you. Just text me if you have questions.
Just text Kimberly at 555-124-3678.
Nailed it. That's all we really have to talk about closing out, right? Oh, and you can follow us on Instagram, which I'll post eventually on. It's been like 3 weeks.
Real selling yourself.
At Nudity Podcast.
Woo!